अब वक्त है योर हेल्थ काउंटर का, जिसका टॉपिक है ओरल हाइजीन बेस्ट प्रैक्टिसेस फॉर हेल्दी टीथ। इस विषय पर विस्तृत चर्चा के लिए हमारे साथ हैं डॉक्टर महेश चौहान। डॉक्टर चौहान ओरल इम्प्लांटोलॉजी, रेस्टोरेटिव डेंटिस्ट्री और एस्थेटिक डेंटिस्ट्री के अथॉरिटी माने जाते हैं। कई राष्ट्रीय और अंतर्राष्ट्रीय साइंटिफिक पब्लिकेशन उनके नाम है। वह एक लोकप्रिय पुस्तक के लेखक भी हैं, जिनका टाइटल है A Visual Guide to Fiber Reinforced Composite in Dentistry। मिस्टर आर शंकर हील फाउंडेशन के प्रेसिडेंट हैं। मिस्टर शंकर का जर्नलिज्म में लगभग 3 दशक का अनुभव है। वे कर्नाटका और केरला से प्रकाशित न्यू इंडियन एक्सप्रेस के रेजिडेंट एडिटर रह चुके हैं। स्वास्थ्य विषयों पर उनकी खास रुचि है और वो इस पर पकड़ रखते हैं। अब तक हेल्थ राइटर्स के 200 वर्कशॉप और 7 नेशनल हेल्थ राइटर्स एंड एडिटर्स कन्वेंशन का आयोजन कर चुके हैं। आज डॉक्टर चौहान से वो विस्तृत बातचीत करेंगे।
This poor oral health has been debated as a possible cause for heart disease for many years. However, in 2012, experts from the American Heart Association reviewed available scientific evidence and concluded that poor oral health hasn't been proven to cause heart disease, and that treating existing gum disease hasn't been proven to reduce risk of heart disease. What is your view on this?
Yeah, it's a very interesting conclusion, and my view is absolutely, I agree with that, because oral ecosystem, there are number of bacteria which live in the mouth, and till date it has not been possible to isolate or culture all those bacteria outside the mouth. So mouth is quite a unique environment in which aerobic, anaerobic, that is without oxygen, with oxygen, whatever type of bacteria they survive. And they have such a combination that each one of us has a resident flora. That means the type of bacteria that live in each and everyone's mouth is very different. So what deposits on the teeth, like soft deposits, are called plaques. And as we know, those are the bacterial colonies. And for heart disease also, to cause inflammation there, the plaques are responsible. So what happens if the oral hygiene is not good? Some of those plaques, they dislodge and get into the bloodstream and cause inflammation at the heart valves and all those things. Not only heart disease, but it has been linked to some cancers also. So keeping a good and clean mouth is absolutely a key to overall good health of an individual.
We have heard of, cardiac checkups. We have heard of diabetic checkups. We have heard of all sorts of checkups. But very, very rarely do people go for an oral checkup or a dental checkup. How vital it is, and how often should people go for such oral hygiene checkups?
Yeah, according to recommendations of American Dental Association and Indian Dental Association, one should go for a checkup every 6 months. That is twice a year for an oral checkup. And contrary to a heart checkup or a diabetes checkup, I would say that oral health checkup should be a pleasant experience for most of the people who are taking good care of their mouth. And the people who are not able to take good care of mouth, for them it may or may not be very pleasant as they perceive, but it will be highly beneficial to them, to get their mouth in order. In fact, in some countries where health budget is being sponsored by state like Germany, etc., it is mandatory for every citizen to go for a 6-month checkup, so that the state doesn't have to foot the bill of extensive and expensive treatment. So it is very much advisable to go for oral checkup every 6 months.
You spoke of pleasant and unpleasant experience. I think some few years back, going to a dentist is as good as, it's a very, very experience that people really dreaded. But now modern technology has emerged such that as you said, it's not a bad experience. It's a pleasant experience also. So there is no problem. So what are the technological leapfrogging that has been done in the field of dental care?
Before the technology, I would talk of the human factor, because fear is all about the mind. So it is definitely the progress has been made in terms of dental education for the dentist to be sensitive towards the towards the need of the patient on a psychological basis also. And talking of technology, the machine advancement and the material advancement has been tremendous since the decade of 50s, I would say. Really, the drill and fill approach changed in the 55s, in the 50s and the 60s, and it has been going on progressing. So the machines with which, for example, the ultrasonics cleaner with which the teeth are cleaned, talking at the very basic for the oral hygiene, those have now very sensitive, feedback mechanisms that, it reacts according to the pressure that the dentist puts or is required for the teeth to be clean. So it automatically adjusts the vibrations and the pulses so that the patient feel pain. And, the anesthetics are more refined, more choice of anesthetics are available. And overall, minimally invasive dentistry, there is a thing called minimally invasive dentistry. So that has been into much vogue these days, so that we don't have to cut more. And that's what my book is also about saving the teeth, not removing the teeth.
You recently wrote on reinforced fiber, the topic that you had given. So can you speak something about your book that you had recently published?
My book basically starts with the genesis of the periodontal disease, what is known in olden time as pyorrhea, and now it is known as chronic periodontitis. So it has been listed in Guinness Book of World Record also that the most prevalent disease that one can suffer from their lifetime is 90% of the population suffers from some kind of gum disease during their lifetime. So it starts with the management and the prevention and how it occurs of the periodontal disease, that is pyorrhea, as it was known in olden days. So, and that basically has to do with the oral hygiene. So how the pyorrhea or the gum disease develops, how it progresses, and then my book focuses on saving the teeth which have been affected at early stage or even at the late stage by pyorrhea. So nowadays, some approach is that, okay, tooth is going bad, remove it, put an implant. I myself am an implantologist, one of the pioneers in India to do dental implants. But, my focus of the book is on saving the teeth, and teeth which have become little mobile, the front teeth, they start moving a little bit if the disease goes unchecked. But that can be treated, and then with the help of fiberglass material, they can be stabilized and they do well for long time. So I have many patients who have 10 plus follow-up in that book, and which is basically hold the emphasis on saving teeth and conservative dentistry, and something which the dentist can do in their office without purchasing very expensive equipment. So it is a cost benefit to the dentist and ultimately to the patient. And it's a health benefit to the patient, the technique of splinting and fiber reinforced composite, which I have, put in there, so that the patient can preserve their teeth and let them function in a good and healthy way.
Coming back to coronary artery disease, now there is also a theory that tooth loss patterns are connected with cornea. How far is it true?
As we told in the beginning of our question answer, when a periodontal disease or say pyorrhea gets unchecked, then the colony of the resident bacteria that develop there, that grows into something else. So it is like that. When the brush is not done properly for 24 hours, you may have a certain group of organisms in the mouth which may not be so harmful. But as it progresses, 48 hours, days, weeks, months, then what happens? It becomes very, very much a permanent resident in the mouth. So, and that if checked, not checked, like patient doesn't go every 6 months for checkup, or is fearful, or is avoiding dental treatment for some reason, then that becomes more and more, and then the plaques go on going in the blood system, and then patient typically may lose lower anterior teeth, lower front teeth, for which again I have devoted much time and writing in my book. and then they typically lose their first molars, from which 60% of chewing is being done. So really, all the parts in the body, all the organs are connected, and we really must take care. Life of animals even depends on teeth. If animal loses teeth, they lose life. It's almost like that.
Now, speaking of animals and teeth, there is a theory that our teeth were designed to bite, chew, and a tough thing. But now, almost all the foods available are very soft, and so are people actually losing the strength of their jaws, especially children?
Well, people are using the strength of the jaw in the wrong reason. They are using the strength of the jaw in the stress, because people are stressed and they clench their teeth. So that is the negative way of using the jaw strength. And these days we have so many patients who have muscle ache and jaw ache and neck ache and cervical and all those linked. But coming back to your question, yes, the processed food, the highly processed foods, number one, they are high, content in sugar. Because even if the things, if for example a savory or a snack we are eating, it is salty, but still it has sugar. So those sugars are doing no good to the teeth, to the gums, to the heart, and factors like diabetes and all that. So the highly processed foods are very easy to chew, almost one can swallow it. But the natural soft food, which were there, like, we may be eating dal, we may be eating rice, we may be eating, boiled vegetables, and of course cooked vegetables. All those things are also soft, but those things are healthy. The problem comes when the unhealthy things are there. They are soft. One, eats them with soda, for example. Then the sodas contain acid, and the soft food contains, starch and sugars. So that's a combination. One may feel full in the belly, but in the mouth or in the general health, it is playing havoc.
Now, you are an authority on oral implantology, restorative dentistry, and aesthetic dentistry. Of course, you briefly mentioned about oral implantology, but I'm interested in what is this aesthetic dentistry?
Aesthetic dentistry has, to do with the beauty of the teeth, and not only color. Of course, everybody may wish white teeth, but aesthetic dentistry also deals with the proportion of the teeth, how the teeth show up when one smiles, and basically the beauty aspect of the teeth and the overall, appearance of the teeth, the ratio of the teeth, how the upper and lower teeth, look, and not only teeth, but the gum health also. So it is the white and the pink. So harmonious, balance of white and the pink and the smile. That is called aesthetic dentistry. And again, as you asked in the beginning, that what modern materials are doing, what my book says. So the modern materials help us achieve the goal of aesthetic dentistry in a very minimally invasive way. But I would caution our viewers about not going too hard for aesthetic dentistry, because some procedures are recommended, but some procedures should not be overdone.
Or what's the latest in braces that children use these days to control their teeth?
Yeah, latest in braces, you can talk of, those are aligners, which are clear, plastic in a way, the mouth guard kind of a thing. So there are different brands available, like Invisalign, clear aligners, etc. But ultimately, it's the doctor who would suggest that, whether you should go for such kind of braces or you should go for conventional braces. So not all cases can be treated by all types of aligners. And especially for developing dentitions, there are different interventions. So basically, the aligners or the clear braces, as they are called, braces without brackets, those are for adult patients.
But speaking of the latest technology, what is the latest in teledentistry, virtual reality, and more important, artificial intelligence, and more importantly, 3D printing?
See, all these things which you mentioned are being incorporated in dentistry these days. For example, if I have to place an implant in the mouth of a patient, I would get the CBCT, which is a low radiation CT scan, cone beam CT for the patient's jaw and the patient's denture. And according to the software, we can plan where to place the implants virtually, and then get a guide made. And according to that guide, we can place our implants in a very exact and very precise location, so that there is no guesswork involved. And the 3D printing, we can 3D print, the guide which will help us, put the implants in the correct place. And nowadays, the crowns and bridges and some of the implant structures which are being made are also made through, scanners and milling method, that is CAD/CAM. So it gives, high precision when the prosthesis, the artificial teeth are being fitted in the mouth, and pre-planning for the surgery so that the surgery is also accurate. So the surgery is accurate, the prosthesis is accurate, and that is how it is being used. And AI, there is yet to be explored more of AI in diagnosis of the the X-rays and the CT scans of the patient, so that even if the radiologist misses something, the AI can detect, for example, if there is a cyst or a crack or somewhere in the teeth.
We hear that post-COVID, we hear that virus can affect the heart, can affect the kidneys and other organs, especially in the light of what is called the long COVID. So do you see any impact of this COVID virus affecting, especially long COVID period, affecting the oral health?
Unfortunately, during the the Delta period, we saw a lot of really bad things like this mucormycosis and fungus and all those things affecting the dental jaws, and the whole jaws were getting necrose and all that in severely affected patients. But the milder effects with the milder versions and milder waves, what patients have been experiencing is a loss of taste, which sometimes goes on for a prolonged period, like months together. And during the severe times, patients also have had bad ulcers in the mouth. So ulcers anywhere in the oral mucosa in the mouth, those were the two things which patient experienced. And of course, if one has had COVID, they should avoid, getting dental treatment for a period which is, until the patient is considered, safe for that. So they should avoid dental treatment at least for 1 month post-COVID, unless it is very acute.
One big problem that we have is oral cancer. How early can you detect oral cancer while you check up a patient?
Luckily for the patients and for the dental health care provider, it is pretty easy in most of the cases, I would say, to identify oral cancer. For example, we may say that, an ulcer which looks bad, which doesn't heal, and which has a clear association with the patient who has had a history of tobacco and alcohol use, and which is associated with certain other observation like a sharp tooth or something. So during a routine screening, during a routine oral checkup, I myself have diagnosed in many patients the oral cancers at initial stage, and the patient has gone then for specialty treatment, and their life have been saved. So the dental healthcare provider has a very big role in detecting early cancer, and of course counseling the patient. Even if patient doesn't have cancer, we can encourage, and we must encourage the patient to follow healthy practices, like not to use smoking or chewing tobacco or alcohol or things like that, which are clearly known factors to initiate oral cancers.
Can you just briefly tell us what is the ideal way of brushing one's teeth, and how often should one change the toothbrush?
The ideal way of brushing is to, for example, if teeth are there, one should keep the brush at 45-degree angle and gently move them back and forth like that. And that will, give a good, clean in all the areas. There are also battery-powered brushes which are available. And the brush head should be selected which is not very large, because if the brush is very large, it will not go everywhere in the mouth. The brush should be selected which is soft, not medium or hard. So the soft brushes clean better. Medium or hard has a possibility of damaging the gums. And when one is brushing, one can mentally divide the mouth segment into 6 parts: upper posterior, upper anterior, upper posterior, and same way left and right side lower. So when one divides, one tends to not to miss certain area, because I have seen that some people who are right-handed, they may brush the right side very hard, while other side they may be leaving behind. And certain areas like the inner side of the lower teeth, that is typically, or the buccal side, the cheek side of the upper teeth, that patient misses. So front, one may brush, but the back one may miss. And when is the time to brush? Change the brushes when the bristles, instead of straight, they become like this. If the bristles open up like a fountain, that is the time for the brush to be changed. And one can keep the brush in sunlight for some time after brushing, so that the brush is naturally sanitized by sunlight.